In Ontario, as in other provinces, patients and their healthcare providers often struggle to get access to specialists. To improve doctors' access to specialists, a secure online platform called Building Access to Specialist Care through eConsultation, or BASE, was piloted in Ontario's Champlain Local Health Integration Network from 2010 to 2011.
BASE is to allow primary care doctors access to specialist advice without having to send their patients to see the specialist and be able to do it electronically through an e-consult.
If I had to refer somebody to a dermatologist or cardiologist, any one of the specialties who we have included on our service, you're normally going to wait, unless it's an urgent problem, you will be waiting several months for that visit.
Our wait times in endocrinology are up to a year for non-urgent cases. So in discussions with one of my primary care colleagues, we say there's got to be a better way than having patients wait. And we were feeling that patients were coming needlessly, that they didn't need to wait a year to come and see us, that we could have addressed this in a much easier, faster way just by communicating with the primary care doc.
As family physicians, we're extremely busy just seeing our day-to-day patients, and to get in touch with a consultant, specifically an individual consultant, to call them on the telephone is often difficult. It's playing telephone tag, and they call you back while you're in the middle of a busy clinic because they're in the middle of their busy clinic and they want to discuss a patient.
There's no doubt there's a lot of what we do is patient physical examination, which is very difficult to duplicate in an electronic format. But we do have images and electrocardiograms that can easily be interpreted and looked at, and blood test results that don't necessarily require the patient right in front of you.
Now they have the option of looking at that specialty and whether it's available through eConsultation, and they will submit that request electronically through a secure web-based mechanism, and a specialist will get notified, review it, and based on the information they could immediately provide the advice. Now we generally ask that they respond within a week, although in practice we've seen that sometimes it takes a matter of hours to get that response back.
There used to be a physician lounge where physicians and specialists would bump into each other in the hospital, and they can often solve issues related to specific patients through a casual conversation. Well, those days are long gone, and physicians miss it. They miss that direct person-to-person contact between themselves and the specialist. So we've introduced that virtual physician lounge through the collaboration space.
Well, it's a real change in philosophy and a change in the way we do business with our primary care doc. So we spent a lot of time with physician engagement and meeting with a small group of physicians and building slowly. It was a new system, so with any new technology, there's always little glitches along the way.
Our objective was not to get widespread deployment. Our objective was to test this idea out. So we wanted to basically work with those who were willing and enthusiastic about trying it out. And then once they've used it, they can give us some very good objective feedback. And that has worked out really well, especially as the feedback has been more and more positive. And that has been the key motivation for other physicians to actually come and seek us out.
First concern was the training and education of the physicians and specialists to deal with it. But because the forums were designed by specialists and by physicians, the training actually is fairly small, 15 minutes, and most physicians can be up and doing a consult.
There are 5 or 6 physicians here at the clinic that are using it right now, and they're all different education levels as far as computer use, and they're having no problem once it gets set up. If you can use email, you can use the eConsult service.
So any family doctor and any specialist who you talk to will identify access to specialty care and the wait times as a major issue that they deal with on a day-to-day basis. What we would hope to see is that over time, if you do have a common group of questions, that in fact you can give a very efficient response, and the family doctor then may no longer need to refer that type of question to the specialist because they have now learned what the typical response is.
To be able to, within less than a week, have an answer the next step, it gives the patient security, it gives them confidence in me as their family doctor. It makes me feel good as their family doctor that I'm able to provide their care. And I think it's just good for the patient-physician relationship.
So what started as just a small project that had, for example, only 5 specialty services available has now expanded to 26 different specialty services.
And what we see is a significantly higher proportion of referral avoidance than we had expected. We thought about 20 to 25% based on literature, but we've seen 40% consistently has been the number that we've been looking at.
We now have over 1,200 eConsults that have gone through the system. If the eConsult service hadn't been available, those patients would have required a face-to-face visit with the specialist. So 40% of those 1,200 consults were avoided landing in the specialist's office. And that, of course, frees up space and time for other patients who do need to be seen by the specialist. To us, the next phase is to see whether it's generalizable to other jurisdictions and to work with Ontario to develop a physician remuneration to make this sustainable.
I think our work is really going to inform and help improve the healthcare delivery in many other regions across the country. So it's very exciting.